So I guess we'll just start off a little bit talking about my background and history and how I got here. I started off as an occupational therapist many moons ago, graduated from Quinnipiac College at the time, and studied occupational therapy, really specialized at first in brain trauma and chronic pain. I worked at Spalding Rehab in Boston for a while, then transitioned to acute rehabilitation in Nashua, New Hampshire at St. Joe's Hospital. So I got to see a wide range of patients. And the best exposure was that I was able to work with professionals, everything from nursing to speech to just all the different testing that was done. So you're immersed quickly into patient care. And then pretty much transitioned into pediatrics. That was my love. So I had my own pediatric business, did after-school programs, advocated for little ones, specialized in autistic and a lot of heavy special needs. And then it started where I was having my own children. And I decided, I'm going to leave the pediatric side of it to my kids and be with them, and then transitioned more to hospice. So I did home care and hospice for about 14 years and loved it, absolutely loved it. And then I found that the stress and burnout was coming to me because there was a break in our system. Our system was broken when it came to insurance. And I loved the patient care, and I couldn't stand the limitations that insurance put on care. So I really have always been interested in the holistic world of medicine. So I learned a beautiful science called Ayurveda, and that is the root of the wisdom of longevity and learning how to live your best life as long as possible, feeling as good as possible. So I still immerse a lot of that in my work now, but I remember clearly in 2015, I was at a crossroads of wanting to add more clinical experience to my practice because I missed that hands-on piece. So kind of put it out to the universe, and we'll talk more about it today in the world of physics and other dimensions. And I'm like, there's got to be something that I could fulfill myself with. And 4 people in 1 week told me about biomagnetism. And that was the beginning of this journey 10 years ago, and took a training in a certain protocol for biomagnetism that focuses on Lyme disease. And that's where my program, my life in biomagnetism took off and has grown since. So that's where it all started. And I have implemented a lot of the Lyme protocol on a daily basis, but at the same time, I have done a little bit of other trainings, and now I've implemented my own works, because what I realized is that the missing piece, and we'll get into biomagnetism some more, is no one was talking about heavy emotions. No one was talking about past traumas. There wasn't a lot of talk on the nervous system and how we are such reactive beings. I know Dr. Joe Dispenza, who's one of my favorite mentors, says that about 70 to 95% of patients that walk into a clinic or a medical facility are there for stress, physically stress-induced and emotionally induced symptoms. And they come out of the body in disease processes. So we've got a real issue. So that's where the root of my protocol took off.
And did you start as a private practice?
I started with biomagnetism as a private practice, just my own little space. I was in a wellness center that we had created, and it picked up pretty quickly. I would say within 4 months, word of mouth traveled, and it's only been word of mouth, quite frankly, which has been beautiful. And you start to see one person, then wait, my brother, and what about my husband? And they've got this symptom. So it's grown from there. But yes, private practice is where I have been, and then worked with a lot of colleagues on it too to help grow a nice foundation for biomagnetism in the southern New Hampshire area.